Now we'll define another terminology, and this is what is known as a pelvic hematocele. So anytime you see hema, just know that it's involving blood. Okay, pelvic hematocele. So the pelvic hematocele is just a rare condition involving this accumulation of blood in the pelvic cavity. Okay, now several things could actually make blood accumulate in the pelvic cavity, which we'll talk about those possible things that can make blood accumulate in the cavity. So let's define it properly. It's localized collection of blood within a body cavity in the pelvis. It typically refers to what? Accumulation of that blood in the pouch of Douglas, which is the lowest part of the peritoneal cavity. So the condition is uncommon, but if it occurs, it's indeed serious. Okay, so several things could actually make blood accumulate in the pelvic cavity. So things like ruptured ectopic pregnancy, ruptured ovarian cyst or blood cyst, pelvic trauma or surgeries, endometriosis, coagulopathies. All of this could actually, make blood accumulate in the pelvis. The symptoms is sudden or severe pelvic pain, signs of internal bleedings, okay, abdominal distension or tenderness. Then can also actually cause shock if it is in severe cases, right? Because you have lost blood, so that's a volemic shock. So diagnosis, you can use ultrasound, CT scans, MRIs, laparoscopy, okay, where you visualize the condition and possibly treat. Then blood test. Treatment is it's actually an emergency condition, so you treat it with emergency hands. Okay, so emergency surgery, laparotomy, laparoscopy, supportive care like intravenous fluid because the patient has lost so much fluid, blood transfusions if needed.